Well, joining us this morning is Angela Morton. She is the Consortium Director with UPMC Western Behavioral Health at Safe Harbor. Is that correct? Fair to say, Angela? I know you do so much, it seems like, but we're glad you're here this morning. Good to see you.
Thank you. Good to see you too, Luke. Yes, you got that right.
There's so much that is going on, and this is a busy time of year. And we talk about at least on this program all the joys of the holiday season, but that's not always the case for a lot of people. There's some that struggle this time of year for a number of reasons, and it's also that time of year where people start thinking, I got to make life changes. I have to watch what I eat, or maybe get through the holidays and wait till the first of the year. That's when I'm going to make a change in my life, health-wise, family-wise, whatever it is. It seems like it's a good, and even for businesses, you think, you know what, I'm going to do things differently next year. I'm going to communicate better. I'm going to do this better, and then you get into it, and life seems to kind of take hold, and it's easy to revert back to the way you've always sort of done things. And that applies to things that you work with, too.
Well,
Maybe you can expand upon that.
We are creatures of habit, so we can easily get into a rut with anything from our work routines, our sleep routines, our exercise, our eating habits, our substance use. Most commonly in our society, the social norms around drinking, especially around the holidays. And for some people, that's fine. They don't drink very often or very much. And for other people, it's kind of a challenge, or it can be difficult to say, hey, I've been trying to cut back, and now everywhere you go, people are drinking and having fun and having Christmas parties. And because not all family events are always joyous, sometimes can be stressful, then people are maybe drinking to cover up the stress or deal with the stress, or maybe if they're using other substances, whether they're using opiates or meth or cocaine or misusing another prescription, that becomes easier and easier when you're under stress and you're trying to mask that stress.
Do you think people have a hard time realizing what might be a joke or an offhanded comment versus the reality? Because people will say, oh my gosh, we're having family over for Christmas or Thanksgiving, whatever it is. I need to pour a glass of wine, or I need to have a beer, or whatever. Do people have a hard time, kind of understanding that line of, maybe if you hear somebody say that, you go, okay, are they joking, or is this an excuse to relapse into those things?
I think it's so socially acceptable that people joke about, like, I've had a rough week. I can't wait till Friday. I can't wait to get drunk, or I can't wait to do a few lines this weekend, or just like shut down all weekend and do a bunch of unhealthy things. It could be like, I'm just going to sleep the entire weekend, or I'm going to eat myself through this weekend. There's just so many things that people do when they want to shut down, when they're overwhelmed, or when they want to feel something. So all joking aside, I've been in the experience with a family member who, when we're at a doctor's office or at the hospital, and somebody made joke that, like, do you need anything? Oh yeah, I could use a stiff drink, and everybody has a laugh over it. But if we don't take those kind of comments seriously, we may miss an opportunity to say, okay, haha, we all have a laugh, but all joking aside, is that something that you do to cope? Is that what you do when you get really stressed or uncomfortable? And it is just opening the door for a conversation. So if somebody says, hey, I'm out of my prescription, I don't know what I'm going to do, I got 3 days left because I used it up, or I've got a week left, instead of joking about it or trying to make light of it, if we can just simply say, talk to your doctor about it. It's a medical condition. When you become dependent to something, you could either be in high risk kind of use, and you may not even have a substance use disorder, but it's kind of bordering on risk, or you may have an active substance use disorder and everybody's kind of making jokes about it. And I'm trying, by doing this, to advocate for more conversations around substance use and getting comfortable saying, hey, all joking aside, have you been drinking a little more lately? Or tell me about that, how you're out of your prescription already, and I make no judgment, but could we talk to your doctor about it? And maybe they know where you could get some help if you need it. Or for doctors to even know how to have those conversations, nurses, receptionists, for us all to have very frank conversations the way we would with any other medical condition.
So we've talked about how you kind of bring this up to somebody that you might think is struggling, right? Is it amped up this time of year with somebody that might be stressed out enough with the holiday situation? And when would a good time be to bring that person in, pull them aside, and say, "Hey, are you okay? Or do we need to talk? Or should we, address, this?"
I would say I like to err on the side of caution, and it can take some courage because one of the symptoms of the disease model of addiction or of a substance use disorder is becoming defensive about it because you are having trouble with it, so you're going to maybe try to hide that. Whether it's because you're spending too much money and someone says, "Hey, you're spending a lot." No, I'm not really. I'm not. We get defensive as human beings when somebody points out something we're doing, especially if it's problematic. So it does take some courage. I think it's best to err on the side of caution and say, start with, I really am saying this out of a place of acceptance and caring about you. I'm not making any judgment. And then even if they say, well, you kind of are judging, well, then help me understand. I want to understand better because I've seen sometimes when you're taking these pills, or I notice that, when you're using Coke, you're doing X, Y, and Z a little bit more, or you're elevated when you're using meth, and I notice you haven't slept in 3 days, and it's just not healthy for you, aside from all the other dangers of it. But really just keeping as neutral as possible, the way you would if you said, "Hey, I noticed your gas in your car was low, you need to fill your tank." So it does take courage, and sometimes people get defensive about it, but all you can do is plant seeds and become a person that if someone ever does decide they want to talk about it, there will be people around that they can say, "Hey, remember that one time when you brought that up to me? I do think I might be struggling."
Yeah, and I was just thinking, it can be stressful all around because you do have the flip side of that would be, are we inviting, Uncle so-and-so or, Aunt so-and-so because last time they were here, their, pupils were dilated, they seem to start fights. I don't want the kids around them if they're going to act a certain way. But again, it can create a unique environment.
Well, again, if we're having open conversations about it, if I had a friend that was always maybe disrupting the party or dinner became a conflict, a friend or family member, and again, it would take a lot of courage and compassion, not judgy, like you're not welcome if you're using kind of attitude, but we really want you to be here and be part of the family. Is there anything you need so that we can really all enjoy our time together? It doesn't even have to be so we can prevent the fight we had last year just to make somebody uncomfortable. But if we say we want this to, everybody wants to be happy together. What can we do to support you? We want you to be part of this. And then just maybe to be prepared that it'll give some fodder for good conversations. But in terms of reducing risk, talking about ways to be safer and be mindful about substance use. We cannot control how people eat or sleep or drink or use substances. We all just are here with each other as humans. So if it means that we just have to have an open conversation to say, I realize what's going on, I want to help you, but I just keep saying keep it open, keep the conversation open, and try to reduce harm and be mindful. Mindful drinking is a thing. You can look it up, like just being more conscious of when you're drinking or how much you're drinking, or breaking it up and making sure you're eating when you're having a drink, making sure you're not using alone if you're using drugs, because people are dying of accidental overdose. So if it means you're going to continue to use, make sure you're not doing it alone, or you are with people and you all have Narcan, or we have fentanyl and xylazine test strips. I said if they came up, I would bring them up, but we have test strips now so people can test their supply, just a tiny bit of it, to see if there's fentanyl or xylazine in it, which is an animal tranquilizer that's very dangerous, that's in the drug supply now. Wow. But if people can test their drugs, as much as in a perfect world, there are people saying, why don't they just quit? But as long as someone is using drugs and we can prevent them from dying, then why not test the supply? And I've been giving them out to doctors' offices and colleges and anybody who welcomes them to give out to people who may still be using. It means that they'd be more mindful of what they're using and knowing what's in it, and then could either not use it at all or use a much smaller amount.
Would you say the mindset has changed a little bit, where it's stopping something cold turkey has sort of been paused to kind of go to that might be worse, maybe start doing less of whatever it is you're doing, and that's the start? Or is it still, no, the best thing is to get them into a place where they are completely off of whatever it is they're on?
Well, it depends on, we do what we call a level of care assessment, and it starts with that phone call to the county just to be screened. And at that point, you can just ask questions. If you don't want to say who you are, ask questions, and then maybe they'll say, can I ask you a few more, and do you mind giving me your name? And maybe it unfolds into coming in and talking to somebody. But when we do a level of care assessment, we are finding out, does a person need like detox or inpatient because they're very high risk, like they maybe could die during their substance use, or somebody who just says, I want to cut back, I'm not using every day, but when I do, I kind of go on a binge, and that maybe they need outpatient counseling or intensive outpatient, or maybe they just need some recovery support, which is available at every county as well. So there are people who would say, I white knuckled it and did it cold turkey. With benzos, like anxiety medications and alcohol, that's actually very dangerous. Like you can have a seizure and die from withdrawal from alcohol or benzos. Opioids, anybody who's been through opioid withdrawal tells me there's no way to describe it. It's not a bad flu. It's worse than you can describe. So although it's not as dangerous, it's very, very uncomfortable. So trying to do that alone without medication or medical guidance can result in just being so miserable 3 days later, 2 days, 5 days later, that you end up using more, thinking, I just need to make this feeling go away. And it's like you're dying of thirst and you need water. Your brain is saying you need to make this feeling go away. You end up using more, and then people are at risk of an accidental overdose. So people have done it cold turkey, but it's better to do with support, whether it's with medical guidance or some recovery support, so that you're not trying to, quote, white knuckle it alone. But anything that reduces harm, if a person says, I really think I can cut back on my own, I'm going to have one less drink a day, that's a start. Or I'm going to use only 2 pills instead of 4 a day. It's all reducing harm. So if a person is able to do that, great. But I would suggest reaching out and getting some recovery support and not trying to do that alone. There are apps, there are online recovery groups, there's AA and NA, there's non-faith-based and non-abstinence-based, meaning even if you're not intending to quit and live in complete abstinence from substances, if your recovery is you're just trying to not use as much or be safer, there are groups for that too, online.
Okay. You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel. Angela Morton with us here this morning. Recovery Is, and you can go to recoveryisnwpa.org to get additional information there. And there's a lot of contact information that you can find through that webpage. Now, you're somebody who doesn't just sit on the sidelines and do your thing. You're always looking to see, okay, how do I better myself? How can I help others? And if you find a gap, I think sometimes you say, okay, I need to learn more about that. Or if there's a class that is offered so you can better yourself to offer additional services, that's an approach you've taken, and you've continued your education in this realm. Tell us what you've been up to.
Well, we, through the grant projects, the Recovery is NWPA federal grant projects through Hemet Health Foundation that are in Venango and Crawford County and in the Corey area, rural Erie County, Corey, that we are hosting and funding certified recovery specialist classes. So the PA Certification Board certifies people with lived experience in recovery to become certified and guide other people in their recovery. And the class also includes certified family recovery specialist certification. So we just hosted one in Venango County, and there are, I think, 10 of us in the class. I'm one of the students, and I'm becoming a certified family recovery specialist because of my own lived experience with substance use and family and friends who have struggled with substance use. So that class in Venango County then will result in more people getting certified to be able to support people in recovery. Crawford County does classes throughout the year as well, as does Erie County. I think every county probably does the classes, some of them more often than others, but we're trying to bring more of them to the area to increase capacity for recovery support in our rural areas.
That's fantastic. Well, what's the biggest thing you've learned?
Wow. They asked us that in last Saturday or Sunday when we were there for class, and I actually got a little bit choked up because I didn't know. I thought I'm going to go in and learn these things or maybe get a refresher on some of these things that I might have already learned. But being with a group of people and listening to their lived experience and their path, it's it's really moving. It's really powerful to hear. You don't hear often enough. So many people in society see people struggling and they don't get to see the other side of the story. When somebody says, I did prison time because of my, the behaviors I engaged in during my substance use or during my process addiction, or that I did things that I would have never done under the influence, except I was in such withdrawal that I didn't care what I did to anybody. And then living through all of that and still thriving, and then choosing to become someone who's going to support other people in that process.
Oh, wow.
It's really, really moving to be in a group of people who we've all kind of bonded and grown together over a few weeks as we've shared our own stories and our own experiences with substance use, and then sharing what it means to us to kind of open our minds and look at different paths of recovery, and maybe not judge that somebody insists on going cold turkey when somebody else is insisting doing NA or AA, while someone else is insisting you have to do it with medication. Go to your doctor and get medication to get through it, that every path of recovery is acceptable, and that we need to guide and support everybody, whatever their path looks like.
And you've, I think, stressed this throughout this year coming on here. Everybody's different. So it's not just, here's a list, do this, and you're going to be better. Every situation is unique and requires maybe a different line of thinking. Even if two people come to you with sort of the similar issues, the treatment or the process that they need to go through could be drastically different.
It's very individualized. Thank you for bringing that up, because I could think I know what a person needs based on just my education and experience in the field as a clinician, but I could meet somebody who I really believe needs like detox, and they insist that they don't need it or don't want it or are unable for some reason. And I could see them a week or 2 weeks later or 3 days later, and they're making their own kind of progress. Or somebody may not be in what we think is severe substance use, but they feel like their life is unraveling and they really need some like intensive outpatient support, like coming 3 times a week for 3-hour groups to really be embedded in a recovery mindset. And meeting people where they are, we all say like we really want to meet people where they are, but we need to really think, if someone says I can't do that, we need to accommodate. We can't say that, well, if you're not going to do it my way, we're not going to support you. We really need to truly meet every individual where they are. So if you meet a person that says, I never intend to stop, can I give you some of these supplies to make sure that you stay safe? Or can I have you use this breathalyzer before you ever walk out of these doors, whether it's to your garage or into a vehicle? So if you're not going to stop or don't want to stop, that you at least are being a little safer for yourself and everybody around you.
Have you found that, I would assume that that's a challenge, because we've talked about it with doctors, healthcare providers, where sometimes it's just easy to write somebody off. And it might be a doctor thinking, this really isn't my department. Here, you go see this person, or I'm not the one to talk to, see ya. But I guess getting those folks to the right person, that's a struggle at times. Where do they go? Because there's so much information out there.
I'm really glad you brought that up too. Like this perfect segue into, I drove here early because I had a car meeting, and we have like a group of physicians that we work with across the region in Venango, Corey area, and Crawford. And we have a Pittsburgh physician who is a really amazing guide. He's an addiction medicine ER doc who happens to also be the director at the Pittsburgh Poison Center, and he teaches toxicology. He's sort of a guide for the group. But we're talking about that very thing. How are we getting out to primary care practices and getting more people in the field aware of where to go? So I said to a friend recently who has maybe had some health issues that could be possibly related to alcohol use. And the doctor was like, yeah, we'll keep an eye on it and do the blood test again in 6 months. Back in the day before people knew what diabetes was, I'm sure that family doctors were just treating it. When they found out what it was, they were treating it. And before there were such things as an endocrinologist where you would go when you were diagnosed with diabetes. So there are not a lot of physicians necessarily in rural areas who practice addiction medicine. but they are here. They're at Safe Harbor in Erie. They are at Primary Health Network. They're, at hospitals and doctors' offices all around the area. There's one in Sagertown who is working to be a champion for medication-assisted treatment. But as practitioners of any kind, if you're a dentist, a physician, an APP, like a nurse practitioner, or physician's assistant, or a counselor, a nurse, anybody who is interfacing with people every day, to know that there are resources and to reach out, and even if you have to ask somebody around you, is there anybody in addiction medicine? I think this person could have some conversations around this, because we keep seeing the same blood tests coming back with it's liver or kidney function or heart conditions relating to food or blood sugar, whatever it is, to say, how do we get this person connected and make a referral to a specialist? Because sometimes until the doctor says, hey, you know what, this is kind of standing out to me now, instead of your family members or friends mentioning it, when your doctor says, this is kind of now concerning me, or it does or did concern me, or hey, your blood test came back again, we need to talk about this, but not just, hey, cut back, but to really be able to say, if you think you can do this on your own, cut back a bit. If you're really having a hard time with it, then let's get you connected to somebody.
Angela, good to see you.
Good to see
Enjoy
you
the
too,
holidays.
Luke. Thank you so much.
All right, thank you.